Good morning, everyone. I'm glad that I am consistent. I think this is the third time that I've started this event on mute. Technology and myself have been weird partners over the past 129 days. Welcome to the third installment of the Capitalize for Kids Virtual Café. We recognize all of you have many ways to spend an hour of your day, and so we're delighted that you're spending it with us and our guests for today's session. The Virtual Cafe, really, we've designed it to try and bring two worlds together. As you know, Capitalize for Kids works seamlessly with kids' mental health agencies across the country to increase their capacity to support more kids and their families. And during COVID-19, we, like most of you, have had to make fairly significant changes to the business operations and the business model in order to deal with the many challenges that the pandemic has thrown at us. With that said, we've been unwavering in our support of our agencies, and we've been pulling back when the change management or system implementations can't be done due to the accelerating impact of COVID. But at the same time, we've been able to get moving on a number of other opportunities where the organizations felt it was quite important to move things forward with Capitalize for Kids. So we've maintained a great deal of flexibility during this time to help support kids and their families dealing with mental health challenges. By engaging through the Virtual Cafe, I think we've created an opportunity to explore the two worlds we abut, the healthcare community and kids' mental health in particular, where we deliver those consulting capabilities, as well as the financial and capital markets community, who financially support our community and dig in many instances with their own time. We're absolutely delighted to host two leaders in these respective Michael includes health system strategy, operations, service integration and partnerships, performance management, facilitation, and decision making. I think Mark is a jack of all trades and definitely a master of regional and local levels. We're also delighted to have Anastasios Avgeriou, who is the Chief U.S. Equity Strategist for BCA Research, an independent provider of insight into global capital markets since 1949. Clearly a firm with great staying power, given that they're older than me and I'm old, and a longtime supporter of Capitalize for Kids. So over the next 45 minutes, we'll have our two speakers talk about the economy, markets, and advancing health, and what all that means and how we bring these things together. We'll have Anastasios speak about the evolving markets and some implications of COVID-19, then transition to Mark to focus on the kids' mental health experience inside and outside the hospital setting. Following their talks, we'll go to a Q&A. I'll remind you after the presentations by our two speakers how you can send questions to the panel. Of course, like all of our events, we'll aim to get you out on time at 12 noon. So now I'd like you to put your hands together and give Anastasios a warm welcome, and I'll turn the conch over to him. Anastasios.
Thank you very much, Quentin. It's a pleasure to be presenting today for this great cause for Capitalize for Kids. So I want to try and share my presentation. I hope you can see it.
Yes, we can see it.
Okay, perfect. So at BCA, we turned positive on risk assets on March 23rd. Actually, this was a reiteration. We were lucky to catch the almost 1,000 point or 1,200 point drawdown in the S&P to the day. We penned a report with 20 reasons to start buying equities on March 23rd, and basically the Fed's QE that was initiated before the March 18th meeting. So the Fed did not even meet on that Tuesday, Wednesday in March. They came two times before the markets opened, one Sunday and also intra-meeting another day. And they really started announcing all these programs, the alphabet soup that they brought back from 2008. And basically, if you look at this chart here, When the Fed does QE, it accomplishes a bidding up of equities and also a debasing of the currency. This is very important to reflate not only global ex-US growth, but also US S&P 500 sales. 40% of S&P 500 constituent sales come outside of US shores. So the Fed's debasing of the dollar is very, very important. They understood this. Bernanke understood it in 08. And of course, now Jay Powell is really, really trying to debase the currency with the liquidity swaps and the ballooning of the Fed's balance sheet. So the primary market drivers since March have been the Fed and fiscal. Those two, so monetary policy, easy or extremely loose monetary policy, and extremely and loose fiscal policy. As a reminder, what the Fed is also doing, if you look here on the second panel, on the second chart, excuse me, on the left-hand side, I show the Fed balance sheet with our projection in the dotted red line going to about $11 trillion by Q1 of next year. And basically, this is the same chart as the forward P in the S&P. And we were at about 3.5 on the balance sheet. We're at about 7 right now. So there's another 4 trillion to go. And on the right-hand side, I show from the Fed's release, they have a weekly release on the money supply that tracks the retail plus the institutional money market fund. So there's a lot of dry powder. The dotted green line is on inverted scale. So this has been a clear support of markets, this massive injection of liquidity, and all this money that's still sloshing around has to go somewhere. Of course, some of it is leaking into equities, and it will continue to do so. And we've had this monster run of about 1,000 points from the lows, a little bit higher than that. And the Fed is there to keep things together. It's a band-aid solution, of course, to allow the economy to recover from the COVID-19 induced recession that we had, or accelerant that we had. So on this slide on page 3, I show the second source of support, which has been fiscal policy, or extremely loose fiscal policy. If you look at, this is a 50 or 60-year chart. If you look at the two of the green line, the unemployment rate, and US government spending as a percentage of GDP, the two are joined at the hip. It's the same chart. And basically, our dotted red line is the projection of US government spending for the end of the year. It could balloon to about 35 or 38 percentage points of GDP. So as long as the unemployment rate stays elevated, fiscal authorities should be together, should stay together and pass another package. As a reminder, the money expires on July 31st. Everyone in Washington is trying to pass another package right now. So there's been a lot of debate going on with the Democrats and the Republicans. And while there might be some tumult until we pass this, I just want to remind everyone that we passed a $2.5 trillion stimulus package in like 4 days. So politicians' minds are concentrated, and I think we will keep on spending our way out of it. Again, this is a gelling of everything together, keeping everything together until the economy will gain enough speed to stand on its own to feed in the US. Now, what does this mean for the markets going forward? What I have here on my second section is our S&P fair value target 3 ways. So every year when the dividend gets released in April, the annual dividend for the previous 4 quarters, we updated a dividend discount model. So I have my assumptions here on the top left-hand side, and basically extremely conservative assumptions, no buybacks going out for 5 years, which is very, very conservative. And the dividend, we assume a dividend cut in 2020 of about 20 percentage points, sideways move the following year in 2021. So no growth in the dividend, and then a resumption of the dividend growth going back to about 7.2%. That has been the historical average of dividend growth in the U.S. for the 500 until since 1960. High quality data from the Standard & Poor's themselves, and this brings me to an ending value of about 3,000. So we're overshooting a little bit, but we always double check our results. And what we do here on the right hand side, I show our 2021 EPS estimate. We think we can reclaim trend we consider trend 162 on EPS. As a reminder, in 2018 and in 2019, we hit this wall after the massive fiscal easing. Of course, this package we passed in Christmas of 2017 with lower corporate tax rates. And we hit this wall at 162 for 2 years running. So this year we're going to collapse to about 110 or so. And we think next year we can reclaim this trend number of 162. My starting point is not 22 or 23 on the forward P that we currently have for the next 12 months, but a bit lower at 19 times. So we get a unique value of, again, 30, almost 3,100. It's 3078. So we can see that even on this measure, the S&P is a bit pricey for our liking right now. And thirdly, we triple check our results and we conduct forward ERP analysis or forward equity risk premium analysis. Our assumption is equilibrium ERP in the US should be last decade's average of about 440 basis points. Again, starting point is EPS, forward EPS of 162. We have a doubling of the interest rate on the 10-year yield going from about 60 basis points to 1.2%. And you back out P and you get a number of about 2920 or so. Again, we're around this 3,000 area that we consider fair value, and we've overshot it for a little bit over 250 points. Now, our view remains sanguine for the next 12 months. However, there's some short-term risks that were really keeping us here to be tactically cautious and not chase equities. And number one is the rise in the polls of a Democratic president. I showed here, Republican minus Democrat from predicted, and it's done this massive gap between the S&P and this probability that's rising for a Democratic president and possibly a blue wave. So the Democrats claiming back the Senate and having the trifecta in the government. And on the right-hand side, and so clearly that's not priced in as a risk. And on the right-hand side, I show in this chart, it's a calendar year chart, and the dotted, the red line is the S&P right now. Shaded areas show what happens during the fourth year of a presidency, going back to 1950 or so. 1952 is the first year, 17 iterations. How does the S&P perform in the fourth calendar year of a presidency? And the average grinds higher. But again, if you look at the top 10th percentile and the bottom 90th percentile, it's pretty wide range. And currently, we're kind of following the bottom part of the shaded area. And the risk is all three lines, if you look at this chart, in September and October are difficult months. So we're worried a little bit for the next 3-4 months. We want this uncertainty to lift for us to become more constructive on a tactical basis. The dollar, I mentioned it before. I don't want to spend that much time on this slide, but if we're wrong and the dollar spikes for whatever reason, there's a risk-off phase, the long-term view will be offside. As I said before, the dollar also reflates, a lower dollar reflates my S&P 500 sales, which about 40% come outside of US shores. So this is a key determinant, marginal determinant of earnings drivers in the US. Now I want to talk a little bit about concentration risk. And basically on this slide, I show the top 5 stocks in the S&P 500 on the left-hand side have the same market cap as 224 stocks put together. And these are early cyclicals and deep cyclicals. So I use Apple, Microsoft, Google, Facebook, and Amazon at about almost 25% market cap weight versus all of the financial sector, all of the real estate sectors are early cyclicals, and all of the industrials, all of the materials, and all of the energy stocks, 224 versus 5, and it's pretty staggering, the divergence that we've seen, or the market cap weights that these 5 companies command versus, half of the index almost. And on the bottom left-hand side, I show this has not been an earnings story. The top 5 stocks have a 12-month forward P of about 42 right now, or 43, coming from 26 at the March trough. So this is not a healthy backdrop. Of course, it's driven by lower real yields. We're minus almost 100 basis points on the TIPS market. You see it here on the bottom right-hand side quarter where I show the forward P of the whole NASDAQ. The NASDAQ composite, that is, so about a big part of the market, not the NASDAQ 100. So we are worried. We want to see this broaden out, and it becomes a big risk on these, $1.5 trillion companies. Now, another way to show this is the top 5 stocks versus the 495 stocks. If you look at the returns that we've had since 2015, the top 5 stocks have gone up from about $1.5 trillion market value to 6.5, whereas the S&P has gone from about 16.5 trillion to 20 or so, excluding, of course, these 5 stocks. And if you plot one versus the other, one is up about 23% or so, and the other guys, the top 5 stocks, are up fourfold. So the relative outperformance is immense, and at the same time is a bit worrisome for us. It's not sustainable, so we're thinking that going forward, there has to be some sort of rotation out of these top 5 stocks to some other cyclical areas of the market. Now, what sectors do we like? Well, here we were overweight healthcare coming into this, and they get a big bump because of the COVID induced recession, as more government spending is getting thrown at these guys. However, at the same time, there's some secular trends, like what we really like in healthcare in the US is the medical equipment guys. We're overweight them. There's an emerging market aspect to it, where they're building their safety nets that we already have here in North America and the developed markets. And basically, my earnings model is telling me the relative earnings are going to continue to outperform the S&P 500's earnings. And while there is some issues with pharma pricing, of course, there was an executive order, 4 executive orders that Trump signed last week. Everyone's out to get the pharma guys, so it's a bit worrisome in our view. It doesn't matter what side of the aisle you are. People are coming out hard on pharma pricing power. They're trying to get drugs even from Canada to get re-imported into the U.S. 80 or 90% of their earnings are coming from domestic U.S. sales, where the government has no negotiating power. And as far as COVID is concerned, while there's been some displacement of some hip replacements, some knee surgery replacements that the baby boomers really want, even open heart surgeries that have been postponed because COVID is taking the center, left, right, and center. I think this will come back at some point. The hospitals are hurting a little bit. There's been some closures and bankruptcies, and the biggest opportunities, in my view, in healthcare remain in this transparency that will come because of tech coming into healthcare. It's pretty opaque in the US. There's a lack of transparency in pricing across the board, not only for the pharma guys, but everywhere. So if tech comes in and really brings down this pricing power that these guys have enjoyed for probably, I think it's 3 decades or longer, it might hurt some parts of the business, but also it will bring up new opportunities. And you don't have to look at any further than Teladoc. What we're doing because of COVID, it's accelerated this push of, meeting physicians over the internet via Zoom or some other platforms like WebEx or Microsoft Teams, and conducting some sort of healthcare through the internet. It's still in the early stages, but it's really going to take off. So we still like this, despite the pickup that we see going forward. I think sticking with even though it's modest for us, modest overweight in healthcare should pay dividends going forward. I think I'm at the 15-minute mark, so I will pass it on, back to Quentin.
Thanks, Anastasios. I greatly appreciate you pulling all of that together. Some great insights into the market and the opportunities that lie in front of us. And I'm sure we'll circle back on some of the healthcare commentary you made when we get in effect, the 2 of you together. So now I'd ask everyone to put your hands together virtually for a warm welcome of Mark Pham from Michael Garron. Mark, over to you.
Thanks very much, Quentin, and thanks everyone for welcoming today. I'll just get my own slides up on screen for everyone. So I will have to say, as I get started, I'm always happy to be able to talk about health and to talk about kids' mental health with a broader audience, and even more so when Anastasios just set me up so well to say that health is also good for capital markets. So I was happy to see some of that. The discussion I wanted to share is just a little bit about kids' mental health in the era of COVID-19, but actually link it back to the economy and where we need to, I think the opportunity for mental health and the finance sector to really work together to advance health and really advance the economic recovery that we have before us. I think no discussion on COVID-19 starts without an understanding of just where we are today. And while Anastasios gave a great overview of the US markets, I'm going to shift our attention back home to Canada, talk a bit about Canada and even right down to the Toronto landscape and what we're seeing both across the country for COVID, but also as we dig into mental health itself. So I think everyone's seen the news that we really are flattening the curve across the country, and we're peaking just under the 120,000 case mark across the country. And specifically now, we're really seeing a consistent volume of less than 500 cases a day, which is great to see. I think Toronto yesterday hit a new milestone of only 1 case in the day, which is great. And obviously, we heard the announcement today that we're going to move to stage 3 in the Toronto area and some other parts of Ontario, which is it's a good milestone of where we are as an economy. You know, if I step back, think about how Canada's fared versus some of our global peers in the U.S., as Anastasios just described. You know, obviously we're seeing a big impact in the U.S. as one of the leading, if not the leading country now with COVID cases. I think we're at over 16 million cases worldwide and over almost 700,000 deaths. In Canada, fortunately, a lower death rate at just under 9,000. So a real impact of COVID on health and society. We're down now to about a 0.4% positivity rate. So that means for really a small volume of people actually testing positive, although we're seeing a large number. And as a system, we're back up. As healthcare, we really are back up much more to what we would have expected to see at this time of year in the summer. We're back up to about 75% of our capacity. And that's often where we see kind of a summer dip in general. So, you know, Anastasios mentioned around the challenges in the U.S. markets around, boomers accessing knee surgeries or cardiac surgeries or others. We're seeing in Ontario and in Canada across the board that lift again of that surgical volume. But as we forecast out, and this will have an impact on economic recovery and getting people back to work, we still have a year's backlog to recover on. So it's going to be a continued challenge in terms of how we respond and how we get ready also for a potential second wave of COVID in the fall. And so it's something that health is actively working on. As we think towards kids' mental health, you know, this impacts kids even more so because, you know, as you heard, with so much shutting down, a lot of the mental health services shut down as well. And just as a backdrop of the kinds of challenges that kids face today in mental health, even before COVID, you know, effectively 1 in 5 children and youth in Ontario, and this is consistent across the country, face some form of mental health problem. But most challenging is that 1 out of 6 will actually get care. And so it reflects the backlogs in care and the long wait lists. It reflects also just the stigma and the attitudes of kids and parents and families around going to receive and seeking care. And so it's a challenge that kids face around mental health, and something that during COVID has been exacerbated even further. You know, you've probably all seen many different studies. There's a great study out of CAMH here in Toronto around the impact of COVID-19 specifically on mental health. And so, you know, the studies done across the country of those who were seeking help in the first place for mental health, where 2/3 identified their mental health declined even further, but backdropped against a community of children across the country, not necessarily those seeking mental health, but just a broad random collection. Even there, 40% had greater concerns around mental health. So it's a big challenge, specifically in children and youth across the country. And this impacts families, and it impacts health services, and it impacts how we kind of collectively get the economy and everything up and running. It's, you know, I think, Quentin, you mentioned at the start, this is 129 days in that we're into this working from home. And, you know, for kids with mental health challenges, perhaps who are in some settings in tougher homes or domestic situations, those issues get exacerbated. For kids who aren't able to get into the structured life of school or daycares, again, those challenges get even further concerned. And when we did have such a reduction in service up front, in the early days of COVID, we dropped to about 25% of our capacity and access for anything other than direct adult COVID-19 response. It was a real service challenge for kids' mental health across the board. And so as we see those challenges, it's now stepping back to say, what's the impact on children? How do we start to support them? And we're starting to see more and more calls from health leaders. I think sometimes it's hard for people outside of health to say, what are we doing to the economy? What are we doing to kids? And sometimes we need health leaders to really step forward. And so I remember it was in late June, early July that we first saw a petition of Quebec physicians across the board, really calling for Premier Legault to get kids back into school and to daycares because of the social and cognitive and developmental challenges that were occurring and the generational impact we're going to have on kids and what that'll do to them as individuals and as society. And then, if I think for this audience, even down the road in terms of their own productivity and impact once they kind of get into adulthood. And we've seen that continue to look at the impact that we're having. There was a recent study coming out, and there's more science every day that we learn about COVID-19 and the impact, not only on the disease itself, but of course on the impact on kids in this case. Well, the risk for kids under 10 for infection and for spreading is actually quite a bit lower than adults. I think the study suggested that kids have about a 5.6% infection rate who are under 10 years old versus 10 and above is more like an adult or about a 20% infection rate of others. So it shows, we get kids back into daycares and enable families to get back to work to both support kids' mental health and their own social and developmental needs, but also to get families back to work and support the economy and the recovery that we all have ahead of us. So a lot of calls coming out of healthcare now to say, as we learn more about the science of COVID-19, as we think about the implications of what's happened, how do we really start to get the markets moving again? And certainly the jobless rate and economic issues that are impacting families also impact kids' mental health. So it's a double-edged sword, if you will. The anxiety that parents have of the unemployment rate that we've seen in Canada, up to almost 14 points in May, and I'm sure it's changed since, really is having an impact on kids as well. And so, kids with those anxiety-related disorders and others, it's actually impacting them even further in this challenges and stresses at home. So if you're at home right now and you have kids and you've been cooped up for 129 days or more working from home, I know I'm fortunate to be working in the hospital every day and not that, but I'm sure if I was at home with my kids, I would at times feel that stress. And so, so the impact that has as parents on kids can actually have quite an impact on both mental health and vice versa on economic return. So what have we been doing in health? We've shifted quite a bit in response to COVID-19. I think the first thing is we really did look at how do we keep services running, but actually enhance them because we recognize the challenge of COVID-19 on mental health services. And so, as a very small microcosm in Toronto alone, we saw half of the inpatient mental health beds for kids shut down because of really repurposing those spaces for COVID-19. And so we were one of a handful that made sure we actually kept our beds open and kept running because we saw the need. And I can tell you those beds have been full since. We've had a real shift to virtual. And so I think Anastasios just talked about that, that across the board, we've seen a real shift to virtual. And this is where technology is finally starting to disrupt healthcare. In healthcare, I can tell you we're typically 10 to 20 years behind the financial sector around technology and technology adoption and how it's really disrupting our care. But if I picked March 12th, I would tell you that we were 0 to 5% virtual in an area like kids' mental health. If I picked March 31st, I would tell you we're 90% virtual. And so it has really been an accelerator of a lot of the change needed in healthcare and the modernization of service delivery in healthcare. So as much as the pandemic has caused so many challenges and grief to society and the system, it's also been, there's always some silver lining in challenge. And this has really been the acceleration. And healthcare is ripe for that kind of technology disruption in terms of where we go. And so now, as we look towards the fall, and we think about a potential wave two, from a healthcare perspective, I can tell you we are planning to stay open for business. We're not going to see the same shutdown that we saw before. We're going to make sure that we are not reducing services and having that same negative contribution to economic recovery as the health system had to happen the first time. We've learned a lot. So everything from how we manage infection control to just the science of COVID and the risk rates. So we really are starting to think a different approach so that we don't have that same impact on surgeries and keeping people away from work or kids' mental health or other factors, and really making sure that we are part of this kind of economic recovery and supporting the solution to what we do going forward. I will say though, in the shift to virtual, when you think about specifically the impact on kids' mental health, while COVID-19 is, we kind of call it the great equalizer in terms of from a clinical perspective, it doesn't matter if you're young or you're old, the disease can really have quite a tragic outcome. But on an access to service, it really has further exacerbated the inequities we have in society. And this is a map of Toronto. If you recognize it, if you're in Toronto, you'll see it. And it's no different than many other communities across the country and in the US around the inequities that we see linked to sociodemographics, lower income, new immigrants, and other factors. And so if you look at this map, in some of the shaded areas, you'll see the Jane and Finch area, you'll see the Thorncliffe Park, you'll see Regent Park downtown and other areas. And these areas relate to inequity scores, but we see them directly related to digital equity issues. And so, 3 out of 100 people who come into the emergency department here at Michael Garron Hospital don't have a cell phone, don't have a data plan. So very difficult to do contact tracing for COVID-19, let alone engage kids in their mental health through virtual care and virtual apps. And so it's further exacerbated this inequity challenge. And again, as we think about technology transformation in healthcare, it's also thinking about how we enable this shift in society and really supporting this kind of inequity issue from the impact on kids' mental health. But let's start thinking about the path forward. So I think this is the opportunity, as I said earlier, for health and finance leaders to really start working together. There was a great letter penned by a number of senior health leaders from across the medical and government and other domains around in July that says an open letter. It really just talks about starting to take a balanced approach, recognizing that COVID-19 has had such an impact on the economy, such an impact on healthcare itself, and that now is the time to really start to think, how do we take a more balanced approach and a modest approach to learn to live with COVID and how we live with COVID, not to accept an undue mortality rate. We have to have a really cautioned and reasonable approach to how we reopen the economy and manage the risks, but that it really is time to take more of a balanced approach. And I think it's this leadership by healthcare that's important to and work with economists and capital markets to help drive it. Canada, we know, has posted, I think, the largest deficit since World War II. Not quite the 38% GDP that Anastasios just mentioned the US is at, but I think at about 14%. I think we had over $340 billion spent on COVID. Our debt to GDP ratio jumping up to 49%. It's a real significant shift. But that's a major concern for healthcare as well. So I think health has to be part of the solution. Healthcare today is 40 to 50% of most budgets across the country. So it's a significant part of the economy in terms of where government spend happens. And to address that kind of GDP hit and the debt that we've taken on, generations past have done this through growth, and it's through that growth in the markets and the growth in economy that countries like Canada and others have solved their challenges. And it's that same kind of growth that we need to think about going forward. If we do the reverse analysis often and see cuts, we'll see significant cuts into the healthcare sector, and we'll feel that impact not only in health and social services, but then the services to support people staying active, recovered in the economy, impacting productivity, impacting other factors. So it really is something where I think there's opportunity to work hand in hand to think about how do we advance not only health and our response to another wave or future pandemics, but really also make sure that we're getting the economy back on track and moving ahead. Early data, there's been a number of calls to say, how do we actually prevent this in the next? I thought an interesting stat just recently published the other day in Science, which has talked about, globally, if we're spending over $11 trillion, some have estimated to actually prevent this kind of a pandemic in the future, if we spend $260 billion over the next 10 years, we may actually get at this. And that comes through any number of different environmental and other factors. But as we think about, where investments may occur, it's these kinds of discussions I think we'll see percolate in society, and that may inform which kind of markets start to rapidly evolve and which may get impacted more. Because we see shifts in the economy to address and prevent these kinds of pandemics. And so it'll be interesting to watch how that evolves, both from a broader societal and economic landscape, but then also the kind of response we have to have in healthcare. So a broad kind of view around healthcare and COVID, but also specifically thinking around the impact we've had on kids' mental health and what we're trying to do going forward. And Quinton, I'll turn it back to you. Happy to engage in some of the dialogue with the group.
Outstanding, Mark. Thank you. Bringing together healthcare and capital markets, financial markets. Appreciate the comments from both of you. Now that the presentations are concluded, I'll remind everyone who's on this virtual cafe that you can access the question box, which should be on the right side of your screen if it's like my screen. And you can send those questions through to Justin Scaini. who will collate the questions for the panel. He will be the only one who can see your questions, so no other participant and or the speakers get to see it. Justin will then curate that and deliver it into us once he's got them in hand. So while we're waiting for that, I'm going to start the Q&A with a couple of my own questions, and they're ones actually I've utilized for the other panels, and I'm always interested to hear how things have evolved since we started this probably 16-ish weeks ago. So there's been definitely an evolving environment. So if we contemplate those last 100 plus days, 16 weeks as a time of, I've thought about it as panic and hope playing out. We've had panic stages, obviously very early going, both in the financial markets and the health markets. We've moved into hope phase and perhaps very green shoots, but then in other markets, back to panic, as you've stated, Mark, particularly in the U.S. markets when it comes to COVID. And yet, Anastasios, we see markets as measured by PE multiples and the like that seem to be going off in the stratosphere. So I'd love for you guys to kind of try and give us a sense of where you think we should be from your views of the world in this oscillation of panic and hope on the way forward for the next 60, 90, 120 days. Mark, we'll start with you.
Thanks, Vince. And I guess I would say from a health lens, and then Anastasios will have a better view on the capital market side. You know, I think we've been kind of through a rotating sine wave, right? So as you say, a bit of a roller coaster, ups and downs. I think every day we're learning more on the science and the policy and the response we need to have to this pandemic, and so we're smoothing that wave. And so I would say that we are on a definite trajectory on the hope side. I think we know we're going to see another wave. We know that it could be worse, like we see flu and other issues impact in the winter season. But I think we're that much more ready for it, and so I would lean more on the hope side that we're on a good trajectory, and then we'll have some bumps in the road, but we'll manage through it.
Anastasios?
Okay, I mean, since March 23rd, since that report, my 20th reason kind of focused on that. And I think as politicians or as governments, we will not make that mistake again. We will not shut down the economy. Just in the US, I'll give you a rough estimate. Every time we shut down the economy for a month, it cost the US $1.6 trillion. That's why the package has been so massive. 1.6 trillion, again, you just divide GDP about 22 trillion or so by 12. Again, rough of the back of the envelope calculation. So we can afford that. So governments become smarter, hospitals, doctors, the whole healthcare system now, it's not an unknown, right? It's not a black swan anymore that hit us in January, and eventually it became a carnage for the market. So now it's a known. So as a society, thirdly, so first, number one, governments are not going to make a same mistake. Hospitals, the healthcare system can deal with it better, meaning we don't put people on ventilators right away, right? We wait. We have a cocktail of drugs, remdesivir, or some other forms, right? There's a chance of a vaccine. So there's possible positive catalysts. And thirdly, as a society, I think we're dealing better with it, right? Maybe in America it's a bit more difficult because there's one gun per person, and there's over 300 million guns. But people, I think it's talking some sense into people to not take it to the guns. And if you have to wear a mask, you'll wear a mask. So I really believe that as a society, we're moving forward. We're getting closer to this idea of wearing a mask that more people, for example, that have been through in Asia, like Hong Kong, Taiwan, Japan, are more used to it. So I think you put all these three things together, and I'm more on the hopeful side.
Thanks, guys. I would say that I'm still often shocked, frankly, in terms of how risk management unfolds with John Q. Public, where you see lots of people cycling without helmets but wearing a mask, and to me that risk management process is a bit odd. One of the things both of you guys mentioned is technology, and obviously, Mark, we've probably seen what we'd consider, certainly at Capitalize for Kids, is we look at our beneficiaries. They've moved with unbelievable amounts of speed in transitioning their business models to a virtual delivery. Things that they would have, a year ago would have said are not possible and wouldn't enable them to deliver value to their client base, and yet it's happening. And then Anastasios, you talked about healthcare towards the end of your deck as being kind of the one opportunity, not only because of technology, which I'd like to hear about, but also transparency. You use those two words. And so technology and transparency. Transparency is an issue in the healthcare sector, having access to your healthcare records, having transparency to contact tracing, et cetera, et cetera. Can you guys just talk about those two words, transparency and technology, and how they might be colliding to create value or not for our communities? Anastasios, why don't you hit it off?
Yeah, so sure. I mean, I think a lot of companies have not been incorporated yet. So it's very difficult to play that theme of transparency or becoming more transparent, especially in the US. I mean, I'm not that aware of the issues in Canada, but I would assume some of them are similar. But in the US, it's so difficult to gain access to records. And I think if there's a big push, for example, from the Apples of the world, from the Googles, from the Facebooks, of incorporating this. I mean, Apple is making huge strides into it with their health apps and, tracking it and putting a record on. There's going to be a massive benefit for the US consumer. Why? The numbers in the US are staggering. Before COVID, about 20% of personal consumption expenditures, which are about 70% of GDP, are healthcare spending. Right? And in the US, the amount of money you spend to extend your life as your life comes to an end is exponential, right? So if you throw everything at it, right? And it could be a bill of $2 million, just spending, two months in the hospital. It's astronomical, the number. So I think technology has a lot to do with it. And we're early stages. It's difficult to find companies that will benefit from it. But I think the combination of tech really now, because of COVID, coming into healthcare will help bring down prices, create this price transparency, and not have all these middlemen that are adding a layer of complexity. And I think, in the US, still, there's millions of people that are uninsured. There's a lot of opportunity, I think, to be exploited from this. And I think governments are not going to, I guess a good segue, we might talk about it later. You mentioned it, Mark, before. We have trillions of dollars being thrown around, and we have the Fed buying this debt, right? So we cap rate. So, in the near term, it's not a problem, but I don't see an end to this being, very spendthrift on the government side.
Yeah, so maybe building on that, I think, Quentin, the first is in healthcare across the board, we have a lot of myths. And one of the myths is you just can't do it. You can't move virtually. It'll impact the care. And I think, COVID has been the accelerator, the burning platform that has proven actually you can do it. And so that has opened the doors to this kind of technology disruption and really a shift in what the care delivery model is in healthcare in general, and certainly in kids' mental health. We've also had a bit of a lower rules environment. So I think we've had lower consumer and patient expectations and more of a comfort and openness to trying something to get, some kind of care versus nothing. So I think all of our customer service expectations were lowered just a little bit to give a bit of grace and to try new things. Even down to, Anastasios, you mentioned some of the big tech companies. You look at what Apple and Google did around making their mobility data transparent and available, and how that enabled us to track. We were tracking every day that data from Apple and Google to understand social mobility scores in the East Toronto area, to understand how that might impact prevalence of COVID-19, how that changed our healthcare delivery services, where we could reopen versus not. So we were using that data because it was finally available and transparent and open. And I think in general, healthcare, and I would even argue government data more broadly, so kind of government or public sector data is really ripe for mining and ripe for what, I know it's all about AI, but really what AI companies and others can do to really disrupt the market. I've often thought healthcare on the public side there's so much data, but healthcare on the public side is so far behind in terms of technology and data tools that we are missing massive opportunities around this. And so the simple things that Apple and Google did around mobile tracing showed how that can really impact public health and public health management. There's so many other aspects in healthcare, I think, in general across the board where we can disrupt, and this data transparency is going to be so critical to see that happen.
Can I mention one other thing that I think it also happened in Canada, where with executive order, they allowed to tap physicians in different states, which was illegal. So if you're in New York and you need an extra physician that's in Utah, you're able to tap them. So I think that's great. And I think Canada did something like that. I'm not sure between provinces if it was legal or not legal before COVID, but at least the government aided in this, acceleration of adoption of the internet and, the technology disruption that Mark talked about.
There is a real people side to that. You're right, Anastasios. We not only brought back a number of retired physicians, nurses, and others, and so can reopen the doors on retirement windows and what that meant. But we also licensed a number of foreign-trained physicians and others who otherwise have a long trajectory or were the folks who just couldn't get relicensed. And so we really opened the door in a different way to get folks back in the market and change, again, that economic productivity we would have from a broad economy, but also specifically delivering on healthcare.
Excellent. Thanks, guys. I'm going to ask Justin Scaini, who has been heading up our impact work, to wade in with his own questions. So, Justin, over to you.
Yeah, there's been a few questions coming in from the crowds. Maybe I'll address those first and then chime in if there's a little bit of time. One of the questions we had coming in, there's a lot of conversation that a second wave could cause irreparable harm to our economies, both in Canada and the U.S., and would love to get your respective perspectives on the economic damage a second wave could do. Perhaps, Anastasios, we'll start with you and then jump over to your perspective in the Canadian context, Mark.
As I said before, I don't think we're going to make the same mistakes we made back in March and April. This overall shutting down of the economy is not going to happen again. I think we're smarter to deal with it. I think it's more of a fear mongering from the media mostly. And at the end of the day, what we need to do best or better as a society is to protect the people that are most at risk. And thankfully, it's not kids. A very interesting chart, if you look at it, is the median age of the death of a COVID patient that dies and the median age of the life expectancy in that country is the same, is one and the same. Right. So this is staggering stats. So we need to protect the people that are in retirement homes, that are the elderly. I think in Canada, the number is 70% of all the deaths are over 70 years old, or 90%. I can't remember the exact number, but it's a very, very high number. Same in Italy. Also, these people tend to have other conditions, right? So there was a study came out of Italy. Most of the elderly that died over there, they have a very high life expectancy. The Mediterranean died, whatever, right? They had a previous condition. So I think we're going to become smarter. I think it's more fear mongering, and I'm hopeful that a vaccine or some sort of, cocktail of drugs will be able to deal even with the long-term ramifications of having had a coronavirus, which has been with us since the 60s, right? So some people are immune to it. We don't know about it, but we don't really test everyone, or we hadn't been testing everyone.
Yeah, I mean, I would concur, Justin, with Anastasios. I think we're going to see a second wave. I would say, there's a risk that we're going to see a heavier second wave than the first in terms of the actual morbidity and mortality, the impact on the health side, but we're not going to shut down the same way. And we're much better attuned to how we respond as a health system, which lets the economy respond better as well. And I think that's the key. I think, as Anastasios, you mentioned earlier, we've seen a real culture shift in society. The simple things like wearing masks and other things, all those will actually also start to reduce other impacts we typically see during this time. So the fear everyone has about a second wave is going to come at the same time as the annual flu surge, where we see flu season, influenza impact. What we're seeing in the Southern Hemisphere, which is always, again, 6 months ahead of us, is their flu season is actually quite a bit less impactful. And the reason why is everyone's wearing masks, they're washing their hands, they're doing all the things that prevent the flu. It's those same measures that will help to prevent COVID. And so I think those things will actually, the societal cultural change will help mitigate the impact of the wave, and the health system's responsiveness and readiness for it. The proactive work we're actively doing into long-term care homes and others to protect that, all those different spaces, I think that will help to mitigate the impact of the second wave. And so we won't see the economy shut down in quite the same way.
Certainly encouraging to hear that from both of your perspectives. And Anastasios, you mentioned that we have fewer unknowns now as we learn more about this thing, and so it's encouraging to hear how much we've learned off the back of what we've experienced over the past few months. As we likely head into a second wave, we're better prepared to deal with it. One of the metrics that you both brought up in different contexts was the unemployment rate. Obviously, Mark, you talked about it through the lens of a key social determinant we need to consider for the well-being, especially those from racialized populations, lower socioeconomic status individuals. And then from your perspective, Anastasios, as a sign of economic well-being, obviously now we have the benefit of hindsight, and we've seen different countries around the world with different approaches to lockdown. Obviously, Canada took a really aggressive approach, the United States a little bit less so, but still aggressive at times. Do you believe that we have taken the right approach with the right level of intensity, or do you believe there were things that we should have done differently that might have had a lower or less pronounced impact on the unemployment rate and the health impacts that's going to have long term? Maybe Mark, I'll start with you, and then Anastasia will jump to you from there.
I think around the world we saw different success rates on how effective the public health measures were in the public health response. And so even if you look at Canada, you see BC, which really had quite a high incidence in the very early days, got right on top of it with their contact tracing, their quarantine, and their management of the disease. So it really reduced, after a couple super spreader events, that one big mining conference, they really reduced the spread of it. And through that, they were able to get through the economic impact that much further. We saw other countries go through this as well. And so I think we've learned a lot in terms of how to contain this disease in a different way so we don't have the same unemployment rate impact. But certainly if we were to do over again, we would have spent a lot more on the public health measures and all that work to really get ahead of the curve. And I think that's the biggest thing. The one thing I will say, though, that I do think we did right is, you think about the stat generally from pharma to bedside of about 17 years to get from research to bedside to actually change delivery of work. We sequenced this genome in 3 days globally. And we have gone from, if you think about a vaccine, there's an active human trials now, we've reproduced 17 years to months. And so I think coming out of this, there's also just going to be a ton of learnings in the pharma and biotech sector around where the investments may be differently and where the markets may go differently around what we can mobilize globally or nationally to tackle different challenges, other health challenges that impact the economy and otherwise. So I think there's things in it.
I just hope you're right, Mark, and they have not been cutting corners on the pharma side by this acceleration, FDA jumping through. But again, I'm more in there's a massive race going on, right? So it's like everyone in the world wants to get this vaccine. So I think I'm more optimistic on that side. But, in the next months, we should have something maybe a bit earlier. But to answer your question, Justin, I have 2 points to make, and you bring me back to a very stressful time in March where I would, get with BCA's clients. And what I would say was the following. I think the measures we took were wrong. We had no plan. That's a big problem. We had no plan, even though Bill Gates has been telling us for quite some time to have a plan. We had no plan. No one in the world had a plan, really. And basically, the solution that we gave was the wrong solution. So my issue is, if you go check data on the link between unemployment rate jumping and suicide rates jumping, and you don't have to go back, to the Great Depression in the US, or heart disease issues jumping and people having heart attacks. When you lose your job, it's a massive, massive stress increase that you have to your family. You might lose your home, right? So heart attacks and strokes. You don't have to go back to the Great Depression in the US in the 1930s, late 1920s, 1930s, after the big bubble we had back then, to go check this data, right? When the unemployment rate shot up to 25%, debt to GDP exploded in the US and globally. Go back to Greece in not that long ago. We had a Great Depression there, 25% increase in the unemployment rate, I think actually 30%, 25% contraction in GDP. And guess what? Greece had no homeless people. One of the highest home ownership rates in the world. Suicide rates. There was, I'm originally from Greece. There used to be no suicides. Then suicide jumped through the moon, and people became homeless. So the long-term ramifications of a high unemployment rate to the healthcare system are graver than what COVID is going to do to it. So I think the solution that we prescribed was wrong. That's why we're not going to make this mistake a second time, and we're going to prevent it. And also from a unemployed perspective or unemployed person's perspective, your skills atrophy. So it's very hard to get back into the labor force. So we need to bring this unemployment rate down. And while it doesn't matter for the S&P 500, again, this is very interesting because most of the jobs that we've lost are low-paying jobs. Right. Nothing wrong with that, mostly in the services industry, like working either in the lodging industry or the restaurant industry or even the airline industry. But what part of this is in the S&P 500? Because it's a market cap weighted index, airlines, restaurants, they're non-existent, right? Same with, of course, hotels and cruise lines. So they get filtered out of the S&P. So it gives you this false sense of, oh, the unemployment rate is shooting up and there's a disconnect between the economy and stocks. But just keep that in mind. I think we're not going to make that mistake again. We need to put these people back to work. And my view is, again, I guess I'm taking a little bit more time, is I think we need to get these people retrained and put them in an infrastructure spending bill that we will rebuild America. And I think this will work also with creek infrastructure across the G7, across the developed world, right? Germany, Canada, we have ailing infrastructure. Cement degrades after being built since the 1960s. So I think we need to retrain these people and move it into infrastructure so all the money that we're spending goes for a good cause. That would be my view, how to absorb this unemployed.
That's very insightful. Thank you for sharing your thoughts on that. And it goes to show between your response and Mark's, bringing down this unemployment rate is critical to the long-term success of recovering from what we've dealt with over the past several months as a global society. So it'll be fascinating to see how that trend evolves over the coming months. We are at 11:57, and as Quentin said off the top, it is our goal to always end on time. So with that, perhaps I'll hand it back to Quentin to wrap things up as we get to noon here.
Thanks, Justin. Great conversation, guys. From my perspective, I've probably got 3, 4, or 6 more questions to ask you, but I guess I'll have to take those offline, given we've come to the end. And as Justin said, delighted that you could join us, create some transparency around a number of these issues that we've been facing as a community, as investors, as those who care about what's going on in our healthcare platforms. It's instructive for us. We hope certainly that COVID, if there's wave 2 and possibly even wave 3, that it's far less than it's been. And to your point, Anastasios, that we're as well prepared, and you, Mark, well prepared to deal with these as hospitals and as economies, so that we don't have the type of impact we've had this far. To all of you, thank you very much to all of our those viewing and listening to this Virtual Cafe. Thanks for your support. Thank you for taking the time to listen to this engagement. We'll have another Virtual Cafe in a few short weeks on August 26th as we head into our big investment conference on October 21st and 22nd. So please stay tuned for that. Again, thanks for your time. We'll let you go. It's now 11:59. Have a great day, rest of week. Thanks all.
Thanks very much.
Appreciate it.